Today we're going to talk about stretching. Now, not the stretching everybody's familiar with, muscles, tendons. Today we're going to stretch nerves. It's really important to stretch nerves because nerves get tight, they get bound down, and they get stuck throughout its path in the body. So we're going to go over upper extremity nerve stretches today, the median nerve, the radial nerve, and the ulnar nerve. Let's get right to those stretches. The first one we're going to do is a median nerve stretch. So how to really stretch the median nerve is a specific position. What you're going to do is make sure the spine is straight. You're going to extend one arm, and of course you can do them on both sides, but we're just demonstrating with the right. A full extension with one arm and thinking and focusing on your middle finger. That middle finger wants to drop down as much as you can. The second maneuver that we do is a little bit of traction to the arm. That further stretches the nerve. And again, we're starting from this position, palm up, finger down, and a little bit of traction. At that point, you might start to feel a little tingle down into that middle finger. But the second maneuver would be slowly laterally flexing the head. That motion further accentuates the stretch of the median nerve. So to stretch the median nerve, palm out to the side, middle finger down, a little bit of a traction force, lateral flexion. We usually do that 3 sets of about 10 repetitions, but that's how to stretch the median nerve, a very important nerve for the upper extremity. The second nerve we're going to stretch is called the ulnar nerve. The ulnar nerve also runs from the neck and traverses the arm all the way down into the hand. For this stretch, we're going to be feeling it in our last 2 fingers, or digits 4 and 5. But to stretch the nerve, we're going to pinch or bring your thumb and your index finger together, almost in like an OK sign. From here, we're going to rotate our arms up to about the eye level. Right then and there, you may start to feel an awkward stretch in the last 2 fingers. That's your ulnar nerve stretching. And we do this with repetitions and sets. So we're going from this position, with the elbows out, up and down. And we'll usually accomplish 10 repetitions of 3 sets, which frees up that ulnar nerve and allows that nerve conduction velocity to flow freely. So the last nerve we want to stretch is called the radial nerve. The radial nerve also starts in the neck and works its way down all the way into the hand. But we're going to focus now on the first 2 fingers, the thumb and the index finger with it. That's where you'll feel some sort of tension or stretching. So what we're going to do is not straight in front of you or right out to the side, but at 45 degrees, you're going to place the palm down. Then you're going to actually do the crane position, bringing all the fingertips together and internally rotating the arm. From that position, we're going to traction force the arm, or a little bit of a reach, and then start side bending. That you'll start to feel down the arm into those first 2 fingers, and that's how you're going to know you're stretching the radial nerve. A very important nerve, innervates many muscles in the body, and ideal to stretch. So as you can see, stretching is very important, and we can't just focus on stretching muscles and tendons. Nerve stretching has been getting a lot of publicity lately and very vital to almost any pathology. So when you're stretching your patients or athletes, keep in mind stretching nerves.